I have to. It has to be perfect, and there cannot be any pause whatsoever. So please walk in front of the camera, Dexter. Okay, Maria, if you don't mind, you're going to be getting plenty of exercise this evening. Okay. Make yourself comfortable. Thank you very much. Okay, let's get started. Today, we are talking about parents who suffer from COPD and what you should expect, especially as a caregiver. First of all, I'd like you to meet my mother. My mother was diagnosed with COPD in her early 60s, and this was as a result of her smoking since she was 14 years of age. Now, you may be wondering, what exactly is COPD? COPD is chronic obstructive pulmonary disease. There's two types, emphysema and chronic bronchitis. My mother had emphysema. Sadly, most patients will exhibit symptoms of both. Now, the symptoms for COPD are wheezing, coughing, shortness of breath, difficulty breathing, and a lot of times pneumonia and bronchitis and so forth. The treatments may vary, will depend on how serious the illness is. In the beginning, it may just be a bronchial dilator, some inhalers, steroids once in a while, as well as oxygen. Now, the one thing about COPD is that it is fatal, but you can live for a long period of time with the disease if you follow your doctor's advice, you take your medicine, you quit smoking, and you stay in a smoke-free environment. Unfortunately, my mother did not do any of this. My mother didn't quit smoking until 4 months before she died. As a result, the disease progressed rapidly, 4 years. Now, one of the things about COPD is that it's very difficult on the patient. Initially with my mother, she did well. She was able to go on about her daily business. All she had to do was take her medicine in the morning. But as the disease began to progress, it became more and more difficult for her to do some of her simple tasks, like just cooking dinner. She would get out of breath and she'd have to stop. And episodes of pneumonia and bronchitis began to creep up on her more and more often, which would, as a result, land her in the hospital. During the final stages of COPD for my mother, they were horrific. She couldn't walk. Sometimes she couldn't talk. She couldn't breathe. She was constantly coughing. Basically, all of her independence was taken away from her because of the fact that every time she took a step, she had to stop and gasp for air. She ended up in the hospital in the last 4 months about every 2 weeks. And she suffered immensely from it. She was swollen from all the medication, on oxygen 24 hours a day, in addition to all of her other medication. And because of the steroids, we had to start monitoring her sugar. For me, as the primary caretaker, initially it was fine. I didn't have any problems taking care of her because she was able to take care of herself. But as I said, with the disease progressing, she required more and more care. She became, more and more limited. She was able to take her medication, but as those medications increased, she required for me to keep track of those medications. At one point, I was going up to her home 4 times a day to administer her medication, to monitor her sugar levels, and to make sure that her oxygen levels were proper. Now, the other issue that you need to take into consideration is the emotional state of the patient. Initially, she's fine, but as the disease progresses, depression becomes more and more evident. Towards the end of my mother's illness, she was so depressed that she became nasty. She would snap at everybody, irritable constantly, and would even make comments such as, "I'm such a burden on everyone in my family, they would be better off if I just died." With that entailed, it was very difficult to manage her mental health because she was in denial that she was depressed. The last month of her life is when she finally agreed that she was depressed and was willing to handle it. Sadly, she didn't have enough time. She ended up in the hospital, and then within a month later, she had passed away. Now, for me, my biggest mistake was that I didn't do the research when my mother got sick. I just took everything for her word. Oh, I've got COPD. Oh, it's no big deal. People live with it all the time. I'll be fine. People have it for years. If I had done my homework, I would have been prepared for what was going to happen to my mother. I would have drove her nuts to make her quit smoking and make everybody stop smoking in her house. I was not aware of this. The last 3 months of her life is when I really became aware of what this disease was. First of all, that's when I found out she actually had emphysema. I just thought it was COPD. Didn't know there was an emphysema. I would ask the doctor questions and I would get, oh, she's fine. You know, it's just a flare-up. When I asked him, how come she's not getting any better? His response was, it's just a flare-up. This is COPD. That's the way it is. I ended up having a hard time with help. Thankfully, my children stepped in to provide that assistance. They provided the daily maintenance of her home and cooking and cleaning and all those different things while I took her to the doctors and managed all of her medical. So the 3 things I can tell you you must do. You must arm yourself with information. Go on the internet, go to the library, ask questions to the doctor, and demand answers. The second thing that I can tell you is you need to take steps to manage the mental health. When you see that the depression is beginning to set in, immediately take the steps to get your parents' help, because that depression is going to wear on you and it's going to burn you out. You're going to become angry. You're going to become angry at your own parent. And the third thing I can say is make sure you get help, because if you don't have help, you're going to get overwhelmed and you're probably going to snap like I did. I started yelling. I started screaming and hollering because I couldn't take it anymore. So make sure that you do these 3 things, and if you do, you should be fine. Thank you very much. And if you have any questions, I'll be more than happy to answer them for you. Thank you.